So today we are very lucky to have Shauna Wright, who is a PhD and the Associate Director of the University of Kansas Center for Telemedicine and Telehealth. With us also is Wendy Garrett. She is a nurse with the Kansas City, Kansas Public School District. And after Shauna's presentation, she will be doing an interview with Wendy Garrett that talks about the school health program that Wendy has been associated with for several years. But Dr. Wright is a licensed psychologist with expertise in providing telepsychology services and training providers in implementation of telemedicine. Through her independent practice, she is experienced in providing telepsychology services to residents of skilled nursing facilities. She also has a background in child and family treatment with a focus on treating underserved populations. Dr. Wright is keenly aware of the impact of the shortage of mental health providers in underserved rural areas, and she sees the promise of utilizing telehealth as a mechanism for increasing access to care. She serves as the project director for Telehealth Rock Schools, a HRSA-funded school-based telehealth network grant program serving South Central and Southeast Kansas. Dr. Wright frequently serves as a facilitator for the University of Kansas Medical Center's Project ECHO, where she enjoys the opportunity to promote integrated healthcare approaches to complex medical conditions. And with that, I will let my esteemed colleague, Dr. Wright, take it away.
Well, thank you very much, Janine, and I apologize for our glitch with the slides today, but I'm glad you're here on the back end helping me move through them. It's great to be here today, and I'm really excited to talk with you about school-based telehealth because in general, school-based health is taking off across our country, and I thought we might start with kind of talking about what that is. So Janine, if you wouldn't mind moving to the next slide. Now, school-based telehealth really is almost an offshoot of school-based health. So I don't know if you all are familiar with the school-based health approach or model, but we have about 10 school-based health models in Kansas throughout the state, primarily in Wichita, Southeast Kansas, where medical agencies, whether that's a federally qualified health center or another medical provider, partners with the school to actually bring clinics into schools and deliver primary care, sometimes even specialty care within the walls of the school. But sadly, as we know, rural states like ours, we don't always have that option to bring care into the schools by setting up clinics within their walls. And so we can rely on telehealth to kind of help support schools or even support schools that have school-based health centers and getting more access to care that's needed in rural and remote areas. There is not a simple definition of what telehealth is in that school model because we really try to cover so much. So we can break telehealth down into three more distinct categories. One would be telemedicine, and that there is your direct service. And that can be, and we'll discuss in just a moment, a variety of areas that we can reach and provide services through an actual direct patient contact service through telemedicine. But we don't want to forget other areas that telehealth can benefit schools and the professionals within their walls. And the second area there is teleconsults, where you might have a specialist, whether that's a behavioral health specialist or a specialist in terms of treating a chronic disease, that can consult with a school nurse, a school psychologist, even a school counselor on the ground and assist with providing, the highest level of care to students in the school setting. And then the third, teleeducation, one of my passions and loves is a way that we can interact with staff in the schools and with the co-ops across the state to help them understand best practices, resources, and also how to network with other providers so that they're able to deliver the highest level of care within the school as possible. So telehealth kind of is an umbrella term that includes a lot of different mechanisms for improving the health care of students within that school setting. Let's move to the next slide, please. So when we look at telemedicine, that actual delivery of service through technology, what kinds of things do people think about treating in that school setting? And I'm hoping that you all attended that first webinar series a couple of months ago that talked about the new telemedicine law here in Kansas. That new telemedicine law hopefully will open the doors in Kansas to what can be provided in schools, because it defines telemedicine and it gives us an avenue to work with payer sources to actually have those services reimbursed in the school setting. So we have many entities that would like to do acute care in the school setting. So that's bringing in primary care to the school setting for sick visits. This can be really crucial to a school setting if they have strep or the flu going around, to be able to have direct care within their walls, especially if they can't, support a clinic inside those walls. But telemedicine can also be used to, assist with disease management, and that can be for those more chronic conditions, asthma, diabetes, children with special health care needs, as well as mental and behavioral health issues. And that can really go across the spectrum, anything from children with autism spectrum disorder, ADHD, social anxiety, depression, those behavioral health issues that children bring to school with them, of course. And telemedicine can be an avenue to delivering those services within the walls. So there's a whole range of direct telemedicine opportunities that can be provided in that school setting. Can we go ahead and move to the next slide, please? So of course, along with telemedicine, we want to look at, how is it received? What do schools think about it? What do students and families think about it? What do communities think about it? When you research the evaluation that's been done on telemedicine, the majority of it's been done on students and families, and what do they think? And what we find across the board is that when we look at these areas, acceptability, effectiveness, and efficiency, we predominantly get good results. Families aren't afraid to use telemedicine, especially if it can save them time and money, and it's easy to use. Oftentimes when we especially go into new communities, there's this sense of, well, will it be accepted? But what we're finding across the board is that it is accepted, and predominantly so, particularly if it's teed up just right and families understand how it works and how they'll be billed, if they'll be billed. Really, families in rural areas and in metro areas are pretty receptive to telemedicine. We do find that it's effective. Not that it's effective for every condition and in every situation, but in terms of if you've built a program and you've defined what that program is there to do, the effectiveness ratings are really pretty high. And of course, we can't say more for efficiency. If you can reach a child in a school setting and maybe even connect with the parent who's at work, if they can dial in on a connection similar to this and participate in a child's appointment without leaving their work setting, that of course increases efficiency. And we'll talk in a little bit about other ways that we improve efficiency in healthcare by delivering medical services to the school. All right, can we move to the next slide, please? All right. So research has shown that telemedicine saves a lot when we look at putting it in the school setting. For parents, we hear that they're saving time away from work. And that's not just, the time it saves in going to pick your child up from school, take them to the doctor, and then possibly take them home. It's also if we can identify a child with an issue sooner rather than later, that child may have less sick days, they may have less time away from school. So that's another way that parents are saving time away from work. Of course, it saves the travel time, the travel miles. And for children, they're increasing their seat time, their time in the classroom within the day if they have an appointment. And again, if we reach them early or address their needs early, then they have less missed time away from school. But one of the important things that we see come from this is that many children are anxious about clinic visits, whether that's to see the doctor for an ear infection or to see a behavioral health specialist for another disorder. If they're able to be seen within the walls of their school where they're comfortable, it reduces stigma and anxiety. I had a school principal tell me just this year about why this was so important in his school. And he said that oftentimes the children that struggle the most you almost have to either beg or chase down in the parking lot when they come back from an appointment, because once they've left the walls of the school, it's really, really difficult to get them back in and get them back in their routine. And so being able to deliver services within those school walls, it assists everybody, maybe even the anxiety of the principal who's trying to coax the student back in the doors. Okay, let's move to the next slide, please. Now, this is where the bulk of this talk comes in. If you do not have a telemedicine delivery system in your school and you're interested in it, we really wanted to talk to you today about what that looks like, how to set it up. And of course, we can't go through all of those issues within this hour, but we wanted to give you kind of a snapshot of what that takes. And I'm going to start that by just explaining that, you know, this diagram right here looks really simple. But typically, if you want to have an effective telemedicine program within your school and really deliver a quality product, you're wanting to do some planning. And that planning could last anywhere from 9 months to 12 months, maybe longer, depending on what you want to deliver and what approach that you're going to take. But if we break it down kind of simply, and our next slide will expand this and we'll kind of guide you through how that looks. But you have to have a strategy. You take the information that you get from designing your strategy to actually design your program. And then that transition piece is where you put the pieces together and you do the training of the staff involved, and before you get to that operational stage. So we kind of break it down into 4 elements, but under each of these elements, it becomes pretty complex. We're not going to go into the depths of this with you today, but I am going to share with you some things that you need to think about and look at if you have interest in developing a school-based telemedicine or telehealth program. So can we go ahead and move to the next slide, please? Great, thank you. So when we get started, when we talk about how to start your telehealth program in your school, it really is on you to explore what does that mean. And we'd start there with a needs assessment. What is needed in your school? Is it, because typically we want to start small and then grow as we gain experience in telehealth and telemedicine. So does your school need support with behavioral health? Does your school need support with a specific medical issue or even access to primary care in the school setting? But you really want to explore what is your need and define that and try to keep it simple at first. You know, we talked with a school recently in the Kansas City area, and when they compared themselves to other high schools in the area, they found that the students within their enrollment were really struggling with managing asthma. And that's a great place to start, to take one area, develop a program, and then as you get through and evaluate how that goes, if there are other areas you want to grow, that's great. But we want to start off just by exploring what is our need, and then that helps us define who do we need to partner with. And when I break down partnerships, we look at partnerships both internally and externally. So if you have an interest and a need to increase access to care through telemedicine in your school, you want to get all of your internal players on board. You want to have an understanding of what telemedicine is and what they bring to the table. So that's going to include your school nurses, possibly your school psychologists and counselors, but also that's going to include your IT staff. You're going to need them. You're going to need them in lots of ways. We'll talk about that in just a moment. But that would include your principals, your superintendents, most likely your school board. And those are all just your internal partnerships. Then you have to look at who's going to deliver these services, you know, and are they trained in telemedicine? Hopefully they have some background there. But you also want to look at community partners. Are there partners in your community that will support this endeavor? Maybe by helping to supply equipment or supply some funds for training, that kind of thing. Or is there a partner that you can make with someone who might do some funding at a grant level, whether that's federal or state or through a foundation locally? Who can you partner with that can bring information and maybe even some financial support to get you up and running? So that's kind of how you start off your strategy, by assessing your need and then having some meetings with your partners to help design what does that look like for you. When it comes to the school setting, when I go through the doors and I talk to schools about setting up a telemedicine program, one of the first things that we look at in designing that is space. You know, what kind of space is available to you, and is it a consistent space? And if it's not a consistent space, is it a space that can be consistent for at least a block of time during a day or during a week? And does that space meet criteria for HIPAA compliance and privacy? Oftentimes schools are so hard pressed to find space to deliver care that it may be a more open space that may not be respectful of a patient or a family's rights to privacy and care. So when we look at design, we don't just look at the equipment. We're going to talk about equipment in just a moment, but we look at where does that program fit within your school walls, and does it meet the expectations and criteria to deliver care. When it comes to equipment, that's all going to be based as you get started up on what service you're delivering. So if you're delivering behavioral health, your equipment needs might be less in terms of what you put in. If you're doing more primary care, you might need some peripheral devices to assist with taking vitals and allowing the provider on the other end to really do a thorough assessment of the child in the office. And then, of course, if you do specialty care, there might be an even higher level of equipment that we need to implement. So equipment design and design of that room is very important to get started. And like I mentioned before, you're going to want to have your IT staff involved in this process, not only to make sure that the equipment will fit and that they can install it, but also to ensure that your broadband and your connectivity can support the telemedicine that you need in that room. And then another part of the design is business agreements. You know, how are you going to fund or reimburse the providers that come in and deliver this service? Now, our hope is with the new telemedicine law in Kansas that through that law, most children who are covered by insurance can seek telemedicine care within their school walls, and their insurance, whether that's Medicaid or a private insurer, will reimburse that. But then we're also going to run into students who may not have insurance or may be underinsured. And we'd want to have a plan for that, and we'd want to discuss that in our business agreements with our partners, of course. And some do sliding scale fees, and some do some pro bono care. And some might even partner with you just for a block of their time. You know, if your school is invested in setting up a clinic or a telemedicine unit, if you have funding, you might provide coverage for a block of a provider's time rather than have them bill individually for the services that they are providing. So all of those agreements need to be developed in this part of the design. The other thing that we would fold in here is the development of consent forms and helping your staff, your students, your teachers, and anyone who's going to support telemedicine understand, you know, how do you consent someone to telemedicine? What does that mean? Do they understand the billing? Do they understand the benefits as well as the limitations of telemedicine? So all of that comes in your design phase. And then as we transition, once we have that designed and we've kind of gotten a nod from all of our important stakeholders to continue moving forward, then we look into how to transition that plan into an active program. And I cannot say enough how much we value training and who needs to be trained. And basically you want to look at that at a broad level across your school and across your community so that they understand what telemedicine is. And then you also want to have some very focused training for those that are within the school walls who will support the telemedicine in the schools. We often call them telepresenters or telefacilitators. Our school nurses, counselors, and sometimes even technicians and support staff will play that role, but we need them to be trained not only in how the mechanism of telemedicine works, but to help them understand how to explain telemedicine to students and families, and how to help them understand how to advocate for students and families if something doesn't go the way they expected. And of course, they need some basic training in how to use the equipment. And so there are so many different factors of training. We need to do our due diligence and make sure that anyone who's associated with the school-based telemedicine program regardless of their role, from IT all the way through that's very, very important school nurse. Are they trained and that, to the degree where they feel very confident in what they're doing? And we want to make sure that training happens before we go live. And part of that training is practice. So we really recommend, if you are launching a new telemedicine program, that you recruit some families, some children, whether they are someone within your school or even your own family members, and do some run-throughs to actually practice with live people who aren't necessarily there for medical or behavioral health care, so that the workflow of a telemedicine event can be practiced with people who will give you feedback and will be patient with you if there's an error or a problem. I can't say enough for training and practice, because we can put hours and hours, maybe even days and days, into designing and developing a program. But if we don't take time to do the training and the practice, it can really be harmful to our program as we move into a launch. And of course, in launching, we want to make sure we've done all that we can to make sure that we've identified the students and the families that we want to be available to reach. So for instance, if you're doing a more primary care approach, as part of your launch, you're going to do enrollment, because primary care is more of an acute event. So you want to know which families are willing to take this opportunity and use it. If you're doing a different type of program, like for instance, behavioral health, where you may have a referral to that service, and it may be a longer lasting service, you may not need to enroll across the school, but you need to have a way to interact with the student and their family, to introduce telemedicine, and make sure that they know it's available and how they can access it through the school. And of course, launching includes, making sure all of your school staff are aware of the program and how it works, and any barriers that a student or family may have to interacting with telemedicine in your school. And then of course we have evaluation. And if you want to maintain your program and make it better, evaluation is always a part of that. And we want to look across the board. What's important to your school? Are you looking at how do students do academically, prior and then post the implementation of telemedicine? Is it affecting grades? Is it affecting attendance? Is it affecting seat time? But then we also want to look at, what does it mean for students and families? Are they accepting of this? Are there any issues that we need to address to make this program run more smoothly? And we also look at stress levels for teachers and parents. Has the accessibility of medical care through your school affected your stress level? Has it affected your relationship with the school? But we want to have a plan for that evaluation and implement it as we launch the program, so that we can understand how to improve a program and also how to maintain it so that it's meeting everybody's needs. And of course, all of this looks like it fits on a simple slide, and there are so many more details. I tried to break this down so that you can understand, to really have a successful program in your school, you go through phases, and sometimes you circle back and have to do some touch up. It's not as simple as, hey, I know how to FaceTime, so let me turn this thing on and let's go. There are a lot of different things to consider and to implement to make a program successful. And if we'll move to the next slide, I'll talk to you about a program that is just fantastic. I have the pleasure of being the project director for Telehealth Rocks Schools. This is a HRSA-funded grant. Primarily the schools that are affected by this grant are in South Central and Southeast Kansas. And it is funded by HRSA, like I mentioned, which means that children who are served under this grant do have access to care, even if they are uninsured or underinsured. So this grant is primarily a behavioral health grant, so it's not delivering primary care into the schools. It's really focused on that needs assessment. The schools in these areas have let us know that they have a very dire need for behavioral health supports, and that's how this program was designed. And we are fortunate that, even prior to the telemedicine bill that was passed here last year, Medicaid reimbursed for telemedicine for behavioral health services. Up until this point, we just don't know, and I'd like to see how it flushes out in January, how that telemedicine care, if we're doing more primary care to the school, how that will flush out. But we know that behavioral health care is covered. But then there are funds to help assist families that don't have insurance still access that care. And we work very closely with school nurses, school psychologists, and even autism diagnostic teams on the ground who make referrals and work with our team to deliver those services. Another aspect of this project, and I'll show you here in a couple of slides, incorporates Project ECHO as a teleeducation to support our partners as they deliver care. And this project is in its third year. Its fourth year it's a 4-year grant. It's in its third year, and we are just delighted to be able to interact with the schools and deliver services to very rural and remote areas. So if we can go on to the next slide, I'll give you a snapshot of, these are the telemedicine services that are available to students and families that are in the grant area and that have partnered with us. So we have everything from direct behavioral intervention for children with autism or on that spectrum, to counseling and therapy. We have a wonderful psychologist named Dr. Skylar Bellinger who does a modified version of parent-child interaction therapy. And in that, the parent actually even shows up at the school. They're not at a distant site or at home. They come on into the school and they do therapy with their child, and the providers in Kansas City directing that intervention. We also are able to provide an online intensive. It's a parent guardian training called OASIS, and it assists parents in developing behavioral interaction skills for children on the autism spectrum. And we're also using that with children with severe ADHD and oppositional defiant disorder. Of course, one of the most highly used services is the psychiatry, the behavioral medication management, and telepsychiatry. Across the state, we are really hard pressed to find available child and pediatric psychiatrists. So as you can see, we have a long list: pediatric obesity, toileting, and feeding difficulties, things that we are able to assist with through telemedicine. And we've had really good response from the staff at the schools as well as the students and their families in terms of how they interact with telemedicine and what their thoughts are about engaging with behavioral health in the school setting through telemedicine. So if we can move on to the next slide, I want to share with you, again, one of our favored activities through the project is Project ECHO. And through this, it's a learning collaborative. And if you haven't heard of Project ECHO, I'd love for you to Google it. Through the Telehealth Rocks Schools program, we have delivered several collaborative learning events focused on everything from problem behavior to pediatric psychopharmacology. This month, actually tomorrow, we will be launching the Irritable Child ECHO, and we collaborate with primary care, school nurses, psychologists, therapists, and we invite teachers to come along for the ride as well. And in doing that, they present cases that are difficult for them to manage in their communities, and our specialty team gives them feedback and guidance and learns from them about their resources and their barriers to delivering care. And it's a great way to kind of wrap around these students and make sure that we're all using the same language and evidence-based approaches when we address their needs. Okay, if we can move to the next slide here. And now I know that Janine introduced Nurse Wendy Garrett. I can't say enough about her. She was kind enough to say that I could interview her. She has been working in telemedicine for years. I'm not going to try to make her sound old, but she's very experienced, and we're very, very lucky through the Center for Telemedicine and Telehealth to work with her and to learn from her. And so I don't know, can we turn Wendy's mic on? Wendy, can you hear me?
Yeah, Wendy, would you please unmute yourself? Just by click on the microphone icon at the lower left corner. Sherry, are you able to unmute Wendy?
I have been trying, Jeremy.
All right. Hi, everybody.
Hi, Wendy. Did you want to take a moment just to introduce yourself real quickly before I ask you a few questions to share with the audience?
Sure. Hi, everybody. I'm Wendy Garrett. I am the lead middle school nurse here in Kansas City, Kansas for the public schools here in town. I've actually been a school nurse for about 24 years, and of that 24 years, I believe about 17 of them have been spent doing telehealth in a wide variety of experiences. So I am loving this experience. I always see telemedicine as such an opening for so many new doors. So I'm excited for today, and thank you for allowing me to come and tell you about what we do here.
Now, you said you've been working in telehealth for about 17 years. Have you had a program live at your school for 17 years, or how long has your telemedicine program existed?
I originally started out at an inner city elementary school, and actually the year I started was the year they introduced it to the school. So it actually kind of became my baby, and I got to implement it into the community and introduce it and kind of build it as I wanted to. We had several schools in the district that had telemedicine services, and they were expanding. So I got to be on that level of it, and I was like the second face for our district and began. And so I have provided telemed services to our students and families for the last 17 years.
So you said you came in on that second phase. I'm sure we're all curious to know, how did telemedicine get started? I mean, what was the tipping point? What was the interest? How did the program get started there?
When it first started, what we were experiencing is there were very few safety net clinics for our parents who may not have a primary care doctor, may not have access to health care. One family told me that at one point they were taking 3 transfers on the bus to get from the neighborhood where the school was to the hospital, and they were actually going to KU. And in that time, it would take them almost 2 hours to do these various transfers and delays and waiting for the next bus to get there. And, you know, when you're maybe taking your sick child and their siblings and you're trying to get everyone across town on the bus, and it's either raining or it's snowing, it was really inhibiting the parents from being willing to, first off, have their child see the doctor and get that needed care. And there just wasn't anything in that area. So it was like, this opened up a door for me. We could provide the service, we could meet the health needs of the child, do a convenience for the parent, and time out of school was minimal. And we were just like, yes, I would love to start this program. And I had actually been at a school prior to that did not have it. Parents had better access to health care, and there wasn't a need for it. And so I really felt like being able to come into this school and to offer the things that we could offer through telehealth really just seemed to fit a much needed niche.
I really love that picture that you just painted. I often, because I'm from a rural area, become so focused on the rural need. That picture that you just painted of what a parent, you know, in that inner city or in an urban area can sometimes go through just to get care. What a great picture to paint and to really highlight that need. Now, Wendy, in your time with the telehealth program, what have you seen change? You know, you've been there, you know, more than a decade with this, and you've talked about how it started. How has it changed over time?
Oh, let me just say the very first change was the bulky equipment. I had a 24-inch TV, and those were the old ones that had the deep back on it. So it was huge. I had a huge cart that we held it on. I had a platform for a light source so that we had an otoscope. Also had a platform for the stethoscope that we could use. So we had all this equipment, and of course, lots of cords everywhere. So I actually had to dedicate an entire corner of my office, which many of you may or may not know, nurses' offices a lot of times are the size of a closet. Mm-hmm. So when you're dedicating an entire corner, almost a quarter of your room to this bulky equipment, you really had to buy into the program to be able to dedicate that much space to it. So we had the space, and just like I said initially, it was just so cumbersome to have everything in place. And then as time went on, we kind of filtered out acute health care, where we were really, and I love that you mentioned we were doing strep tests, we were doing ear infections, we were looking at rashes. The challenge became, how can I make this doctor see what I'm seeing in the office and get him to hear the sounds that I'm hearing? And how do I communicate to him? My assessment skills had to be honed and had to become so much better, because I had to be able to guide the doctor in the areas that I was seeing and show them what we saw, and then listen to what they were asking me to do to facilitate a better assessment for them. So it was really a learning and growing program, and it was lots of challenges in trying to make this be a working program for the kids. And just those kind of challenges getting into that point of becoming familiar with everything. Changes after that, when we went to having a computer-based camera. Boy, I tell you, I ended up having so much extra space in my office after that. It was really a lot of fun just to have a little camera to utilize instead of half my room. The downside of that, though, was that we were no longer doing sick child visits. And so that service went away as safety net clinics in the community started developing. And we were no longer finding a need for it, because basically within a 2-block, 3-block radius, my parents have access to doctors. And so as that need decreased, we weren't using the clinic as much, and then they actually phased it out, and we became more of behavioral health. And,
but isn't that neat that you follow the trends of resources? Because telemedicine is often used when the resource isn't there. And we do have to be able and ready to transition as our resources change around us. And it sounds like you all have done a really good job with that. So as that transitioned for you, who's a part of your team? If you're focused mainly on behavioral health, who's a part of your telemedicine team there on the ground?
I'm going to start building level, because without the building support, we wouldn't make it. My principal and my administrative staff have been fabulous. Many times, and I'll explain, I did start out at an elementary school. I'm now in the middle schools, and we have over 700 students in our school. And so, I, of course, don't have a chance to know all the students as well as I did when I only had 200 kids in an elementary school. But my admin may have a conference with a parent, kind of tell the parents a little bit about what's happening and ask, would it be okay if I brought the nurse in? We have a program that might benefit your child. And when I start, that is my first avenue. And they're willing to have me come in and speak to a parent. And I explain to them what the service is and how we can help them, and how, what are the benefits versus taking them out of the building and seeking out resources outside of the school setting. And as you said, the parents are always so excited to know that, number one, the time away from work will be less because there's less drive time. The time away from school will be less because they're not leaving the building. And, it's like that convenience alone for a lot of parents is, let me start there. My teachers, just the other day as I'm walking down the hall and I walk past a teacher, we do our friendly, hey, how you doing? And then she turned around, oh, hey, miss. And I turned around, what's wrong? And she said, I've got a kiddo I've got to talk to you about. Would he be a candidate? And she starts laying out a little bit about what's going on. And I'm like, he's perfect for that. Let me reach out to mom. Or I say, and actually the way I do it is I say, have you spoken to mom about this first? And if they haven't, my encouragement is talk to the parent a little bit, see if they're saying the same concerns you do. If they do, then tell them we have a program here at school and ask if it's okay if I call. And just that avenue in, parents are really, it's like they've heard that, they're ready to go. They want to know more about it, and we get that. We have a community of support where community support people are in and out of our schools, and they're very interested in it. They've been very supportive of it. They tell other people in the community if they're welcoming new members into the community, they talk about it. I've had a couple of parents say, hey, I was talking to so-and-so and she mentioned that you have this. What is that exactly? And we talk about what we can do, and is it a service their child might take advantage of, or just how that it can be utilized. So word of mouth and success and seeing it work has really helped in the building to get buy-in.
I really like that you shared, how you introduce it to not only the teachers, but to the families, and how you go through that process. I know we want to leave some time for questions for our audience members. I have just a couple more questions for you, though, if we can, and hopefully we can get through that and leave a couple of minutes for our audience to ask questions if they'd like. But could you, we've talked about all these positives with telemedicine, and I'm wondering, are there barriers that you faced? And if so, how did you overcome them?
Community-wise, you really have to know your school and your community. If you have a community that really doesn't buy into mental health or doesn't buy into behavioral health, that is the first stigma that really creates a barrier. And, I've had a lot of parents say to me, nope, I don't care that ADHD and just throwing meds at him, that's not going to work. I'm not interested in that. And he'll have to learn to behave. And trying to help them understand that even if they choose not to do medicine, getting the information from the doctors, talking to them, maybe seeing the psychologist and getting some support and ideas on how better to help the student in school or how better to help the child at home, having them even just get experience with the system and how it works, and that we're not just about shoving a pill down your child's throat, and how can we help this to be a benefit to your child. The other barrier, and lately it has become a much larger barrier that I'm really struggling to find a solution for, is I have a high level of immigrant families who really could benefit from this. And unfortunately, because we don't have insurance for these folks and they're not eligible for insurance, I can't get them the service that we'd like to provide for them. And so then we really are trying to access safety clinics who serve the uninsured population and see if we can help them get services that way. But that is my biggest frustration, because it's like, when I first started out, because we were grant funded, everybody was seen no matter what. And then as, of course, with all healthcare, the evolution of where we've gone with it and how expensive it is and how to fund it, that is probably my biggest frustration and hindrance.
Well, and we have a lot of compassion for that. It's interesting to me, though, that the barriers that you see really they're part of that planning and problem solving process, maybe not even specific to telemedicine as it's delivered, but that the community is receptive of the service that's available through telemedicine, and that they also have the resources they need to access that resource. So very, very interesting response. And it really speaks to how we plan and how we support these programs, because we know that they're needed. All right, I'm going to ask you if you can share this with us just very quickly, and then we'll open up to any questions. Could you quickly share a favorite memory or experience that you have with telemedicine in your work with it?
I actually have two, and I'll be very, very brief with it. I had a little one come in and she told me her ear hurt. And in the course of getting to look at it, and of course I still had the otoscope so I could put it right up on the screen, I actually found a bug in her ear. And when I called the grandparent, she was like, oh no, that'll never happen. Grandparent actually got to be here. I put the otoscope in the ear. She could see it. Oh, we've got to take care of this. It was so immediate, because it wasn't just the nurse seeing something, but it was actually grandma seeing it and being able to verify, I need to take care of this immediately. And it was just such a fast and positive response, because there was no accusations. It was just, there it is, plain and simple, and let me go. Along the same lines, we were able to get a little girl seen who was having a pretty severe asthma issue. She ended up having to be hospitalized for about a week because the asthma had actually gone into a more pneumonia, or having pneumonia after that. And the really interesting piece of it was mom was not interested in taking her across town to the doctor. So I really feel like without that intervention ahead of time and her willingness to see the doctor on telehealth there in the nurse's office, this little girl might have been, remaining at home untreated for longer than she was. It could have exacerbated and gone much worse. So it was really, really successful stories on getting the interventions for the kids and helping them to be okay and to be healthy.
Great. Thank you for sharing those stories. Now, Janine, I don't know if you wanted to take questions. I see that we have one. Do you want me to ask that, or did you want to take over from here? Well, I see that
There
Janine.
I am. Okay. No, if you see those questions, that's great, because my screen is full of the PowerPoint. So that would be fine if you want to go ahead and do that.
Great. Wendy, we have a question that says, how does having telemedicine available in schools, from your opinion, affect the academic success of your students?
All I can tell you from my perspective is that what I have seen, and I've gotten reports from let's review, like for a child with ADHD who is receiving medicine versus they're not receiving medicine. When they do their Connor scales and they send them in, and the teachers do their scale as well, you're seeing a vast difference on the success of the child from the teacher's reports. Parents may or may not see as much of it, but we do see as a teacher's report consistently, and I always approach the same teachers to get the same, usually it's my math and my reading teachers that I approach to get that feedback. We can see the improvement in that. And one of the things that I do is I do follow up with the teachers and the parent and try to track how the kid's doing. Is he getting his work done? Are you seeing better test scores? So it's sort of, for me, it's more of just a subjective, I go check in. But I do get reports from teachers telling me where they see positives or when they start seeing that it's not as impacting, or where barriers place, so that we can evaluate whether the treatment is still effective or not.
Great. Very good. Now, I see that Jeremy, for all of you that are attending, Jeremy has posted information on how to connect with our Irritable Child Echo that starts tomorrow. I'm going to ask you, I know we're running short on time, but Wendy, have you participated in any of the Project Echoes? And if so, what are your thoughts on them?
I love the Project Echoes. For a positive piece of it, I don't have to try to find a sub and take off work in order to be able to learn about things that are appropriate and impacting to the school nurse setting. Also, it's kind of nice to be able to get some CEUs out of it. Always a good one for those licensures. On a frustration scale, my office, I cannot believe I have silence here. I put signs up so I actually could be uninterrupted right now. But normally my office is a revolving door, and it's really hard to focus sometimes when the kiddos are coming in and out. But even then, as they figured out that I'm like, shh, nurses in class, and they're like, oh, let me see too. So a lot of times there'll be this face trying to come up beside me to see what I'm looking at. I have found them to be very beneficial. I actually put out a couple of emails to our staff and have done it, made it available to the rest of the nurses in our district. And we have 45 nurses, and at various times, I think I've had 20 to 25 of the nurses popping in to see what one of the echoes or another, just because it's effective and appropriate to what they're working in.
Thank you for sharing that. I appreciate it. I think that's all of the questions we have for right now. Janine, did you want to take back over now, or?
Sure. We just want to thank everyone for joining our third series of the HTRC webinar series, and we look forward to seeing you again in December. That information will be out momentarily. We make sure that we do those one at a time so that we can have the sign in so that you can get those CMEs, which I know are important to you. So thank you again, Shauna and Wendy, for giving your time and your talent to us today. very informative. And as we move along and you have more questions about school health, then do not hesitate to reach out to the HTRC, to Shauna, or to Wendy. Thank you. Have a good rest of your day.
Bye, everybody.
Thank you.